Well, of course, it's not a fire break. It'll just delay the transmission of the virus by a bit. Obviously, if people aren't in contact with other people, then it's more difficult for a virus to spread. But as soon as you lift the restrictions, then the infection rates will start to rise again. And this is so patently obvious. Then, unless we're going to commit ourselves to permanent lockdown forevermore until either we're all dead or a virus is invented, then what's going to happen is that Britain will remain as a kind of open prison or series of gulags around the country with borders that we can't lawfully cross. And the economy is going to crash, and millions of people are going to suffer, not just economically, but also in terms of their mental health and physical well-being as well. We know that there are masses and masses of other serious diseases and conditions which have gone untreated and undiagnosed as a result of the emphasis which the NHS has put on COVID. So, this is a zero-sum game. I mean, there is a real price, a real cost to the kind of policies which are being imposed upon us by governments that want to control us and everything around us. And who are the scientists who are saying this? It's certainly not Professor Sunetra Gupta, who is the leading epidemiologist at Oxford University, or Sir David Spiegelhalter, who is at Cambridge, or Professor Hugh Pennington, who's the Emeritus Professor of Epidemiology at Newcastle University, or any of those who signed the Great Barrington Declaration. Thousands of competent, real medical scientists. What the government is doing is listening not to scientists, but to mathematical modelers. And mathematical modeling is not science, it's guesswork. It's garbage in and garbage out. That's why when Professor Ferguson of Imperial College predicted in an early stage of this that there might be 500,000 deaths as a result, it gives you an idea of how preposterous some of these predictions are. I had a meeting with one of my health authorities, which covers the whole of southwest Wales, Pembrokeshire, Carmarthenshire and Cardiganshire, on Friday. And there are three people in hospital in Llanelli with COVID and 3 in Aberystwyth. And one of the 3 in Aberystwyth had been brought up from hospital in Swansea. This is an area which covers, I don't know, 500,000 people or something of that kind. And that's the real, not just an infection rate, but people who are seriously ill.
It's now been locked down. Because
it doesn't really matter how many people are infected, so long as they don't experience any real adverse symptoms. Actually, what we want to do is encourage the disease to be transmitted amongst those who are not going to suffer any real ill effects. What we've done, or not what we've done, what our governments, with their all-knowing aspirations, have done, is to delay the onset of the latest transmissions of this disease into the autumn and the winter, when we're going to be least able to counteract them. Contrast that with Sweden, where the average death rate per day, without having had a statutory lockdown, has been between 1 and 2 deaths per day in the entire country for the last 2 months. And there is no uptick in Sweden in deaths. It was front-loaded. They suffered in the same way as we did at the start, but because they took a more mature approach to this, they're now reaping the benefits.
Where do you see?
We will make America great again.